We're here to talk about epilepsy. Over to you, Brian.
Epilepsy is a condition that affects the brain and causes repeated seizures, also known as fits. Epilepsy affects more than 500,000 people in the UK, so 1 in every 100 people. Some people with epilepsy simply experience a trance-like state for a few seconds or minutes, while others lose consciousness and have convulsions and uncontrollable shaking. Epilepsy is most often diagnosed after you have had more than one seizure. This is because many people have a one-off epileptic seizure during their lifetime. The most important information needed by a GP or neurologist is a description of your seizures. This is how most cases of epilepsy are diagnosed. While medication cannot cure epilepsy, it is often used to control seizures. These medicines are known as anti-epileptic drugs. Most seizures are successfully controlled by these. In some cases, surgery may be used to remove the area of the brain affected or to install an electrical device that can help control seizures. People with epilepsy can experience any variety of seizure, although most people follow a consistent pattern of symptoms known as an epilepsy syndrome. Seizures can occur while awake or asleep. Doctors classify seizures by how much of the brain is affected. Partial seizures, where only a small part of the brain is affected, and generalized seizures, where most or all of the brain is affected. Some seizures do not fit into these categories and are known as unclassified seizures. There are 2 types of partial seizure: simple partial seizure, where you remain fully conscious throughout, and complex partial seizure, where you lose your sense of awareness. Symptoms of a simple partial seizure include changes in the way things look, smell, feel, taste, or sound, intense feeling that events have happened before, known as déjà vu, a tingling sensation, or pins and needles, in your arms and legs, a sudden intense emotion, such as fear or joy. The muscles in your arms, legs and face may become stiff. You may experience twitching on one side of the body. The symptoms of a complex partial seizure normally involve apparently strange and random bodily behavior, such as smacking your lips, rubbing your hands, making random noises, moving your arms around, picking at clothes, fiddling, adopting an unusual posture, chewing or swallowing. During a complex partial seizure, you will not be able to respond to anyone else, and you will have no memory of the event. In most cases, a person having a generalized seizure will be completely unconscious. There are 6 main types of generalized seizures which are explained now. Absence seizures, sometimes called petit mal, mainly affect children. They cause the child to lose awareness of their surroundings for up to 20 seconds. The child will seem to stare vacantly into space, although some children will flutter their eyes or smack their lips. The child will have no memory of the seizure. Myoclonic jerks cause your arms, legs or upper body to jerk or twitch, much like if you have received an electric shock. You should remain conscious throughout. Clonic seizure causes the same sort of twitching as myoclonic jerks, except the symptoms will last longer, normally up to 2 minutes. Loss of consciousness may occur. Atonic seizures cause all your muscles to suddenly relax, so there is a chance you will fall to the ground. Unlike an atonic seizure, tonic seizures cause all the muscles to suddenly become stiff. You can lose balance and fall over, usually backwards. Tonic-clonic seizure, sometimes known as grand mal, has 2 stages. Your body will become stiff and then your arms and legs will begin twitching. You will then lose consciousness and some people will wet themselves. People who have epilepsy often get a distinctive feeling or warning sign that a seizure is on its way. They're known as auras, but are actually simple partial seizures. Common warnings include noticing a strange smell or taste, feeling of déjà vu, feeling that the outside world has suddenly become unreal or dreamlike, unexpected weakness, experiencing a sense of fear or anxiety, your body suddenly feeling strange,